I have the honorable task of going through this, and Mark keyed it up for me, so I have no disclosures with this talk. We know that people in the U.S. use VCSS and SEEP scores to report. How many people in the audience are doing it now in their history of physical? Yet Medicare requires it in most regions. So I'm not going to go through all of it, but we know there's C2 disease and C2 disease. And what are the problems? The problem is that there's no single tool to provide a complete picture. There's also inconsistent treatment algorithms and inconsistent patient care, challenges with reimbursement and appropriateness. And the goal is to incorporate patient-reported scores. So as we know, in 2011, there were varicose vein guidelines, and now it's been updated to 2022. And the interesting thing is that SEEP has now been upgraded to a good practice, and the VCSS score was not challenged that I saw, and I'll leave it a 1B. The European Society of Vascular Surgery graded it as a 1C for SEEP, and for VCSS a 2AC. So that being said, let's talk about SEEP and VCS and outcome assessments. So the outcome assessments help to determine the progress of the patient. Specific questionnaires are relevant to the patient's chief complaint, given the patient before treatment again and various re-examination intervals, and considered to be indicators to whether a patient is improving, staying the same, or getting worse. So the history of SEEP started in 1994, and then, as you saw, it was revised. The problem with SEEP, as we know, is that it's relatively static. It's a classification and not a score, and does not allow assessment of change in response to treatment of adverse events. The history of VCSS started in 2000, and it was modified again or revised in 2008. And it's a good system to look at before and afters. How many people know about VV-SIMQ, the Hasty score? So this is a varicose vein symptom questionnaire called Hasty: heaviness, achiness, swelling, throbbing, itching. The duration of the scale is 0 to 5. How much of the time? Total 0 to 25, average over 7 days. But essentially, if you look at it, it's a validated score. And in 2015, the paper came out and said that the VV-SIMQ instrument is a reliable, valid instrument, responsive to measuring change in the patient's experience of varicose vein symptoms pre and post intervention, and is uniquely focused on patient-reported symptoms. So if you look at these cases, this is a 48-year-old female complaining of right leg varicose veins with symptoms of GSV reflux, had thermal ablation. So she was scored as a C3 and a VCSS as 6, and you can see preoperatively here how that was ascertained, and then post-op you can see that it was C3 with a VCSS of 3. So you can see that there were some important changes. Now if you look at VV-SIMQ, you can see that it's scored as 11, heaviness, achiness, swelling, and throbbing, and you can see the different times. Most of the time was graded as 4, all of the time would be 5, none of the time would be 1. So, and then after post-op, you can see, none is 0. Then you can see what happened here, and that's a significant change. Let's look at a different case, the same 48-year-old female with the right leg varicose vein symptoms of great saphenous reflux, thermal ablation, and you can see that a C2 patient, VCSS of 5, and you can see how that was scored. The VCSS post-procedure was 3, and you can see that the varicosities disappeared. Now, when you look at VV-SIMQ, all of the heaviness, achiness, swelling, throbbing, itching didn't change. So did we help that patient? So I think it's a reliable score. So ladies and gentlemen, in conclusion, there's a potential utility in combining classification, SEEP, physician-reported outcomes, VCSS, and patient-reported outcomes, Hasty score, to understand the patient's clinical severity and superficial venous disease. Thank you very much.